2020 continues. Here's John Stossel.
Everyone says if you don't have health insurance, you're in real trouble, which also suggests that having insurance removes that risk, right? That it solves your problems. But maybe not. You're still at risk.
Come on, Janelle.
Kent Valley's self-employed, so he bought a health insurance policy for himself and his family. 2 weeks after the policy went into effect, Kent says his thigh swelled up after it was hit during a game of pickup football.
My significant other, she said this swelling doesn't, it's not going down, it doesn't look normal.
Kent went to a doctor.
He says, Kent, this is a little bit more than just swelling. Well, what do you mean? And he says, well, this looks like it could be a liposarcoma tumor.
A cancerous tumor had been growing in Kent's thigh. He says the swelling from the football injury made him notice it. Blue Cross authorized several rounds of costly chemotherapy and surgeries. For 4 months, the insurer accepted Kent's bills. But then
I see a letter from Blue Cross, and I opened up the letter thinking it was a normal, payment letter.
It wasn't. Blue Cross had canceled his policy, leaving him with $200,000 in medical bills. Why? Blue Cross believes Kent already suspected something was wrong when he applied for insurance, but he didn't tell them.
They say that I lied on question 18 and 19 on my application, which was thoroughly untrue. Here, use that color.
Kent is suing Blue Cross.
I've lost everything. I've lost 3 houses, lost my car, contemplating bankruptcy.
Healthcare problems like Kent's are the focus of Michael Moore's new documentary, Sicko.
Health insurance companies suck. Flat suck.
I'm calling for the elimination of private profit-making health insurance companies. In my perfect world, they wouldn't exist.
And he gets applause for saying that. Here at the Cannes Film Festival, Moore and his movie got a 20-minute standing ovation. The California Nurses Association gave him another. Earlier, they marched from the State House demanding that the government take over health care. Sicko points out that health insurers have an incentive not to pay.
When you don't spend money on somebody, it's a savings to the company.
They make more money the less they give us.
That's right. So they have to do things like deny care. They have to do things like tell a hospital, no, you can't do that operation for that patient, or tell a doctor, no, you can't send that person to a specialist. They have to do these things if they're going to make money.
But Moore never confronted the insurance industry about that, the way he's done in other movies.
Congressman Castle.
Why didn't you confront them?
Well, because, that's a good question. In my other films, usually you see me. You're famous for that. I'm walking up to the door of the CEO or whatever. In this film, I want the audience to get up out of the seat. I want the audience to become active and involved.
Since he didn't go after the executives, I decided to try. It wasn't hard. The insurance industry isn't hiding from reporters. You're not like barring the door saying I can't see Karen.
Oh, not at all, not at all. You're very much welcome here.
Industry Association President Karen Ignani is eager to tell anyone that most claims are paid.
We have a claims denial rate on average of 3%.
But people hate their health insurance companies.
I feel very good about the care that individuals who are in health plans are getting. I look at the data every day.
Polls do show that most people who have insurance are satisfied with their coverage. But what about people like Vicky?
That little pill's $300.
She's already sick, so insurance companies won't take her on unless she pays them a fortune.
If we were to take this individual into our healthcare systems along with all the working families and the other individuals who are already there, it means that for them, their costs would increase quite extraordinarily.
That's just the cold, hard fact about insurance. It's a risk pool. People pay premiums into one pot, and the people who don't get sick pay for those who do. The more sick people an insurance company takes on, the higher costs are for everyone. So insurance companies have a reason to avoid people like Vicky.
Go that way.
They also have a reason to investigate people like Kent. Kent still insists he didn't lie on his application. But this week, Blue Cross sent us notes that show Kent saw a doctor about the growth in his thigh the day before he applied for insurance. Insurance companies do need to double check because some people do cheat.
The FBI says the fraud involved more than $1 billion.
To try to protect themselves from fraud, insurance companies create another problem: paperwork.
Charts, everywhere. More here, everywhere. This is where some of the money goes. This stuff is not free.
Dr. Melvin Gerald has to pay 4 employees just to do insurance paperwork. On average, doctors spend 14% of their income on it, and lots of time.
And some of that time we should be spending with the patients.
But the biggest problem with insurance is that it creates nasty incentives. It encourages us to spend more and not to think about what things cost. What if your car insurance covered oil changes and gasoline? You wouldn't care how much gas you use, and you wouldn't care what it cost. Mechanics would sell you $100 oil changes. But that's how it works in healthcare. And some people demand oil changes whether they need them or not.
But the patients who have insurance, they don't ask. They just say, some of them tell them do this, do that. And some of the things they don't need to have done.
The patients say, do this and do that, because they're not paying. And since patients don't care about costs, neither do doctors.
It's gotten to the point where doctors don't even know how much it costs them to provide this service or that service, or how much an office visit should cost. Try asking a doctor how much an office visit costs and watch their face go blank.
So when people complain that there are
40 million uninsured,
45 million.
46 million.
47 million uninsured.
I say the bigger problem may be that 250 million of us have health insurance. Because imagine how different your life would be if insurance paid for other things you need. What if you had grocery insurance? You wouldn't care what things cost. Why buy hamburger? I'll just buy steak. Why look for sales? Why use coupons? I'll just buy everything. My insurance company's paying.
We'd make a lot more money.
You could raise your prices.
We definitely could.
John Mackey's the founder of this chain, Whole Foods. He laughs at how grocery insurance would change shoppers' behavior.
They'd buy a lot more because they're spending somebody else's money now.
People would buy a lot more of the wild-caught king salmon from Alaska for $20 a pound than they would this farm-raised tilapia for $6.99 a pound.
Instead of buying a bottle of wine for $7.99, they might buy a $300 bottle of wine.
And yet this is how we pay for health care.
I know. It's ridiculous.
When 2020 returns, is healthcare really better north of the border?
They live 3 years longer than we do. That's the line I want to be in.
Oh yeah? Next.